Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Pharmacology. A client has been taking benzonatate, Tessalon as ordered. The nurse tells the client that this medication should do which of the following? Option A. Take away nausea and vomiting. Option B. Calm the persistent cough. Option C. Decrease anxiety level. Option D. Increase comfort level. Right answer is option B. Calm the persistent cough. Benzonatate is a locally acting antitussive. Its effectiveness is measured by the degree to which it decreases the intensity and frequency of cough, without eliminating the cough reflex. Central venous access devices are beneficial in pediatric therapy because option A. They don't frighten children. Option B. Use of the arms is not restricted. Option C. They cannot be dislodged. Option D. They are difficult to see. Right answer is option B. Use of the arms is not restricted. The child can move his extremities and function in a normal fashion. This lessens stress associated with position restriction and promotes normal activity. Fear may not be eliminated. All lines can be dislodged. Even small catheters can be readily seen. How can central venous access devices, CVADs, be of value in a patient receiving chemotherapy who has stomatitis and severe diarrhea? Option A. The chemotherapy can be rapidly completed, allowing the stomatitis and diarrhea to resolve. Option B. Crystalloid can be administered to prevent dehydration. Option C. Concentrated hyperalimentation fluid can be administered through the CVAD. Option D. The chemotherapy dose can be reduced. Right answer is option C. Concentrated hyperalimentation fluid can be administered through the CVAD. In patients unable to take oral nutrition, parenteral hyperalimentation is an option for providing nutritional support. High concentrations of dextrose, protein, minerals, vitamins, and trace elements can be provided. Dosing is not affected with options A and D. Crystalloid can provide free water but has very little nutritional benefits. Hyperalimentation can provide free water and considerable nutritional benefits. Some central venous access devices, CVAD, have more than one lumen. These multi-lumen catheters, option A, have an increased risk of infiltration. Option B, only work a short while because the small bore clots off. Option C, are beneficial to patient care but are prohibitively expensive. Option D, allow different medications or solutions to be administered simultaneously. Right answer is option D. Allow different medications or solutions to be administered simultaneously. A multilumen catheter contains separate pots and means to administer agents. An agent infusing in one pot cannot mix with an agent infusing into another pot. Thus, agents that would be incompatible if given together can be given in separate pots simultaneously. Some institutions will not infuse a fat emulsion, such as Intralipid, into central venous access devices, CVAD, because option A. Lipid residue may accumulate in the CVAD and occlude the catheter. Option B. If the catheter clogs, there is no treatment other than removal and replacement. Option C. Lipids are necessary only in the most extreme cases to prevent essential fatty acid, EFA, deficiency. Option D. Fat emulsions are very caustic. Right answer is option A. Lipid residue may accumulate in the CVAD and occlude the catheter. Occlusion occurs with slow infusion rates and concurrent administration of some medications. Lipid occlusions may be treated with 70% ethanol or with 0.1 millimoles per milliliter NaO. Lipids provide essential fatty acids. It is recommended that approximately 4% of daily calories be EFAs. A deficiency can quickly develop. Daily essential fatty acids are necessary for constant prostaglandin production. Lipids are almost isotonic with blood. A male patient needs a percutaneously inserted central catheter, PICC, for prolonged phototherapy. He knows it can be inserted without going to the operating room. He mentions that, at least the doctor won't be wearing surgical garb, will he? How will the nurse answer the patient? Option A. You are correct. It is a minor procedure performed on the unit and does not necessitate surgical attire. Option B. To decrease the risk of infection, the doctor inserting the PICC will wear a cap, mask, and sterile gown and gloves. Option C. It depends on the doctor's preference. Option D. Most doctors only wear sterile gloves, not a cap, mask, or sterile gown. Right answer is Option B. To decrease the risk of infection, the doctor inserting the PICC will wear a cap, mask, and sterile gown and gloves. Strict aseptic technique including the use of cap, mask, and sterile gown and gloves is required when placing a central venous line including a PICC. Options A, C, and D are incorrect statements. They increase the risk of infection. A male patient is to receive a percutaneously inserted central catheter, PICC. He asks the nurse whether the insertion will hurt. How will the nurse reply? Option A. You will have general anesthesia so you won't feel anything. Option B. It will be inserted rapidly, and any discomfort is fleeting. Option C. The insertion site will be anesthetized. Threading the catheter through the vein is not painful. Option D. You will receive sedation prior to the procedure. Right answer is Option C. The insertion site will be anesthetized. Threading the catheter through the vein is not painful. Pain related to PICC insertion occurs with puncture of the skin. When inserting PICC lines, the insertion site is anesthetized so no pain is felt. The patient will not receive general anesthesia or sedation. Statement 2 is false. Unnecessary pain should be prevented. What volume of air can safely be infused into a patient with a central venous access device, CVAD? Option A. It is dependent on the patient's weight and height. Option B. Air entering the patient through a CVAD will follow circulation to the lungs where it will be absorbed and cause no problems. Option C. It is dependent on comorbidities such as asthma or chronic obstructive lung disease. Option D. None. Right answer is Option D. None. Any air entering the right heart can lead to a pulmonary embolus. All air should be purged from central venous lines. None should enter the patient. Kent, a new staff nurse, asks her preceptor nurse how to obtain a blood sample from a patient with a PICC device. The preceptor nurse teaches the new staff nurse. Option A. The sample will be withdrawn into a syringe attached to the PICC needle and then placed into a vacutainer. Option B. PICC devices are not used to obtain blood samples because of the risk of clot formation. Option C. The vacutainer will be attached to the PICC needle to obtain a direct sample. Option D. Any needle and syringe may be utilized to obtain the sample. Right answer is Option A. The sample will be withdrawn into a syringe attached to the PICC needle and then placed into a vacutainer. A special PICC needle is used to access the PICC device. A syringe is attached and the sample is obtained. One of the primary reasons for insertion of a PICC device is the need for frequent or long-term blood sampling. A vacutainer will exert too much suction on the central line resulting in collapse of the line. Only special PICC needles should be used to access the PICC device. What is the purpose of tunneling? Inserting the catheter 2 to 4 inches under the skin, when the surgeon inserts a Hickman central catheter device. Tunneling. Option A. Increases the patient's comfort level. Option B. Decreases the risk of infection. Option C. Prevents the patient's clothes from having contact with the catheter. Option D. Makes the catheter less visible to other people. Right answer is option B. Decreases the risk of infection. The actual access to the subclavian vein is still just under the clavicle, but by tunneling the distal portion of the catheter several inches under the skin, the risk of migratory infection is reduced compared to a catheter that enters the subclavian vein directly and is not tunneled. The catheter is tunneled to prevent infection. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.